Since 1934, the Jewish General Hospital has been providing cutting-edge treatment and compassionate care to patients from diverse religious and cultural backgrounds in Montreal, throughout Quebec and beyond. Between the 1880s and the 1920s, millions of Jews from Eastern Europe and Russia flocked to North America to seek refuge from religious persecution. Many thousands of them settled in Montreal and substantially increased the size of the Jewish community that had existed in the city since the 18th century. Although historically Montreal was far more tolerant towards Jews, religious prejudice still existed, even in the 20th century. Jews sometimes encountered great difficulty in obtaining proper health care and in finding employment in Montreal's leading hospitals. This prompted medical and civic leaders in the Jewish community to establish several small clinics starting in the 1910s. However, as the new wave of immigrants poured into the city, a larger and more comprehensive solution was required by the mid-1920s. After a series of meetings in the late 1920s, Jewish leaders and philanthropists reached the consensus that a fully equipped hospital had to be built. There was also unanimous agreement that while the new hospital would serve the city's Jews, it would welcome patients and staff from all religious, ethnic, cultural, and linguistic backgrounds. On September 22, 1929, a mass meeting of more than 3,000 people was held at the Mount Royal Hotel to officially launch a fundraising campaign to build the hospital. Unfortunately, only a month later, the stock market in New York crashed, and this triggered the Great Depression, a calamity that threatened the ambitious plans of the hospital's founders. Nevertheless, the desire for a Jewish hospital was so strong that almost every pledge was eventually honored, even though some cash-strapped donors took until the 1940s to fulfill their commitments. On October 8, 1934, the Jewish General Hospital was officially inaugurated, and a week later the first patient was admitted. The hospital's initial decade was a difficult one, as the new institution coped first with the Depression and then with the need to support Canadian and Jewish efforts during World War II. However, starting in 1936, the Women's Auxiliary, now known as the JGH Auxiliary, provided the hospital with much-needed equipment and services through a wide array of committees and initiatives. The end of the war saw the beginning of an era of dramatic growth and heightened medical sophistication and innovation. From 1951 to 1972, the hospital housed its own school of nursing, and during the 1950s and 60s, new wings were built to accommodate the growing number of specialized departments, divisions, and programs. 4 major milestones were reached in 1969, with the opening of the Lady Davis Institute for Medical Research, the launch of the Institute of Community and Family Psychiatry, the establishment of the JGH Foundation, and the granting of McGill University affiliation to most of the hospital's departments. As the pace of growth intensified in the 1970s and thereafter, the Jewish General Hospital made an ongoing effort to ensure that patients' rights and needs were properly addressed. For instance, in 1973, the JGH became the first Canadian hospital to create the ombudsman-like position of patient representative. In 1974, the Herzl Health Center, which had undergone many changes in location and mandate in order to meet public demand for its services, merged with the hospital and became the Herzl Family Practice Center of the Department of Family Medicine, offering a full range of family health services to a diverse community. And in 1981, the auxiliary lent its support to the launch of Hope and Cope, a visionary and pace-setting support program for cancer patients and their families, which is now internationally recognized for its excellence. In the 1990s, the hospital enhanced its expertise in various clinical areas by further expansion, more unprecedented medical achievements, and its pivotal role as a refuge when crisis hit the society. Year 1990 saw the launch of 3 new pavilions: the Cummings Family Pavilion, where the Siegel Cancer Center is presently located, the Peter and Edward Bronfman Pavilion, and the Shirley and Leo Goldfarb Center for Radiation Oncology. In the same year, the McGill AIDS Center was inaugurated at its home base in the hospital. After the birth of Quebec's first quintuplets in 1992, doctors from the obstetrics and gynecology and the pediatrics and neonatology departments of the hospital continued to make medical history by successfully providing care for the miracle baby, Melody English, who grew and survived inside her mother's abdomen instead of her uterus. In 1998, during the ice storm crisis, the hospital opened its heart to the community and provided shelter to upwards of 250 individuals, a concrete example of commitment to its mission of caring for the community. The Jewish General Hospital takes great pride in its history and is pleased to be able to present this video in collaboration with other institutions during the Jewish Montreal Heritage Week. The photographs in this video are drawn primarily from the hospital's archives and feature only a few of the many treasures in the JGH's heritage. The pictures emphasize the period from the early 1910s to the 1990s in order to showcase the events that have brought the JGH to this inspiring point in time and to illustrate the foundation upon which the hospital is building for the future.